Hello everyone, my name is Emily Wood, and this is my capstone presentation for graduation with a Bachelor of Science degree in nursing from Nebraska Methodist College. The public issue I've chosen to discuss today is prenatal substance abuse. Prenatal substance abuse is when a woman ingests alcohol or opioid medication at any point during her pregnancy. This can be devastating for a baby, both while in the womb and throughout the course of its life, as prenatal substance abuse can lead to physical, emotional, and psychological issues. I chose this issue because it is one that is prevalent in the state of Nebraska. According to the Center for Disease Control in 2018, 1.2 out of every 1,000 women who went into labor was addicted to an opioid medication. My personal connection to this issue is that I work in a neonatal intensive care unit and have seen firsthand the detrimental effects that prenatal substance abuse can have on infants, mothers, and their families. The purpose of this presentation is to discuss how I have become an educated citizen during my time at Nebraska Methodist College, and how I will take what I have learned and apply it to the public health issue of prenatal substance abuse. During my time at Nebraska Methodist College, I've had numerous opportunities to work on becoming a reflective individual. An experience that stands out to me was during my sophomore year at Nebraska Methodist College when I took a pathophysiology class with Dr. Heather Henricks. The class was very difficult, so much so that I had to drastically alter my study habits and how I learned and retained information. I had to seek out additional resources from my professor and others and learn different ways to study. For example, I learned how to effectively use flip lecture recordings. I also learned how to highlight my notes to keep them organized. What I learned about being a reflective individual from this experience is that there are certain situations where I must integrate learning from a variety of disciplines, specifically in regards to engaging in habits of inquiry. For example, I had to integrate new ideas and styles of learning into my study routine. I also routinely had to engage in critical thinking and the use of logic throughout the course of the semester in order to ensure that I would be successful in my study of pathophysiology. I can use what I've learned from this experience when caring for patients and families dealing with prenatal substance abuse, because it will be important for me to integrate all my knowledge and education in caring for these patients. I will take what I have learned from my humanities classes and apply it to how I relate to my patient and their family on an emotional level. I will take what I have learned from my applied science classes in order to apply it to how I explain the detrimental effects of prenatal substance abuse. The second opportunity I had to work on becoming a reflective individual was during my junior year in my Nursing 340 rotation, when I had the opportunity, as part of a clinical requirement, to conduct vision screenings at a school in a low-income, underprivileged area of Omaha, Nebraska. During this experience, I worked with students between the ages of preschool and 5th grade who came from a variety of cultures, ethnicities, and socioeconomic backgrounds. It was during this experience that I was challenged in a new way to practice being a reflective individual. One of the things that I learned about being a reflective individual from this experience is how to more critically analyze perspectives of holism. I learned that I must keep an open mind and an open heart and get to know an individual or a group of people and not let my view or opinion of them be clouded by negative preconceptions. I also learned that treating every person with respect and a non-judgmental attitude will help me not only become a better nurse, but a better person as well. I can take what I learned from this experience about treating and seeing individuals in a holistic way and apply it when caring for my patients who are dealing with prenatal substance abuse or the aftermath of it. Seeing my patients in a holistic way will allow me to focus on treating and caring for them without letting biased or invalid preconceptions about their life circumstance interfere with my ability to build a trusting, caring relationship with my patient and their family. I also had numerous opportunities to work on becoming an effective communicator during my time in the nursing program at Nebraska Methodist College. The first occurred during my sophomore year in my Nursing 240 maternal newborn clinical rotation. I had the opportunity to work with a nurse and assist a laboring patient throughout her 16 hours of labor. Her nurse and I worked tirelessly, performing several nursing interventions, including pain medication, position changes, verbal encouragement, and therapeutic touch. It was not until an epidural pain device was placed on the patient that her pain finally came under control and she was able to continue the labor process. What I learned about being an effective communicator from this experience is that sometimes as a nurse, I can communicate just as effectively, if not more effectively, by using nonverbal communication skills, such as being fully present or providing therapeutic touch to my patients. Nonverbal communication techniques allow for the patient to know that I am fully present, yet it does not require them to verbally respond if they are in pain or feeling weak. I can take what I learned from this experience about being an effective nonverbal communicator and apply it to clinical situations where I have the opportunity to care for infants who are dealing with prenatal substance abuse. Using nonverbal communication techniques will convey safety and comfort to infants withdrawing from substances by not having an overstimulating effect that talking or singing can have on them. The second experience that sticks out to me in regards to how I have grown as an effective communicator was when I had the opportunity to lead the supplemental instruction sessions for Dr. Heather Henrich's pathophysiology class in the summer of 2018. Within a few weeks of the semester starting, I discovered that my students learned much better with visual diagrams and group discussions, rather than by filling in the worksheets, as I had used with previous cohorts. As a result, I drastically adapted my SI teaching methods to a more visual and conversational style, with the hope that I would be able to better communicate with my students in both verbal and nonverbal contexts. What I learned about being an effective communicator from this experience is that individuals have many different learning styles, several of which are different from my own. I realized it is in these situations that I need to use critical thinking skills in order to better organize and convey my ideas to my students in both verbal and nonverbal contexts. I also learned that there are situations where I may need to communicate in both verbal and nonverbal contexts simultaneously in order to ensure that my message is being communicated and received effectively. This experience, what I learned, will help me when caring for patients with prenatal substance abuse, because I will understand that not every person has the same educational or learning needs. I will remember when giving my patients information, medical updates, or education to watch for verbal and nonverbal cues in order to ensure that the message I am conveying is being communicated and received effectively. I also had the opportunity during my time at Nebraska Methodist College to really work on becoming a change agent. The first experience that sticks out in my mind was during my sophomore year when I worked as a college ambassador. As an ambassador, it was part of my duty to assist with events such as transfer nights, new student registration days, and new student orientation events. I worked closely not only with the other ambassadors, but also with the ambassador advisors and several faculty and staff at Nebraska Methodist College. I also had the opportunity to interact with countless new students and parents by giving them tours, assisting them getting registered for classes, or simply talking with them to help calm their fears as they embarked on this college journey. One of the main things I learned about being a change agent from this experience is that I started to develop cultural competence in the sense that I began to more fully respect and appreciate the views and opinions of others. There were many times throughout the course of my time as an ambassador, throughout the meetings and events, where I needed to show respect for another individual's point of view, even if I did not fully agree with it. Additionally, throughout this experience, I was able to work on becoming a change agent, and that I was consistently working to draw our team together as a group so that we could promote team unity at the various ambassador events. I can take what I learned from my ambassador experience and becoming a culturally competent change agent when working with patients dealing with prenatal substance abuse by realizing that individuals from different cultures may have different cultural norms than I am used to. This could include the use of alcohol or other substances during pregnancy. As a nurse, it will be important for me to show respect for the different opinions and viewpoints of my patients who are from different cultures, especially when educating my patients about the harmful effects of prenatal substance abuse. Showing respect for different cultural opinions will help me build rapport with my patients and also facilitate good communication between nurse and patient. The second experience I had that allowed me to become an accomplished change agent was during my senior year in my Nursing 450 class. I had the amazing opportunity to participate in a high-risk pediatric simulation scenario. In order to participate in this event, I was required to complete an online quiz before the experience. Unfortunately, when the quiz results came back, the answers to the quiz were in complete contrast to what we had learned in our pediatric textbook. Upon discovering this, I respectfully brought up the situation to my professor and asked if she would be willing to look into it. Upon further investigation, it was discovered that the quiz answers were indeed incorrect. The professor not only adjusted the entire class's grade, but she fixed the quiz itself so that it would be correct for future cohorts of nursing students. What I learned about being a change agent from this experience is that a person does not have to have a formal title or be in a formal leadership position in order to create a voice for self and others and initiate positive change. In addition, I learned personally that by creating a voice, that I became empowered to do it again in the future. I can take what I learned from this experience about creating a voice for myself and others, and taking appropriate measures to initiate change and apply it to the issue of prenatal substance abuse, in the sense that I can advocate for policy change in the facility where I work in regards to how we care for and treat mothers and infants who are dealing with prenatal substance abuse. In the same way, as a private citizen who is also a healthcare professional, I can create a voice for the infants who have become the victims of prenatal substance abuse and advocate to initiate change at the state and national level regarding laws and statutes to protect the innocent victims of this condition. In conclusion, this presentation has discussed how I have grown to become an educated citizen during my time at Nebraska Methodist College by becoming an accomplished, reflective individual, effective communicator, and change agent. This presentation has also recapped a few of the experiences that have contributed to my growth in these areas, and it also discussed how I will use what I have learned and apply it to the public health issue of prenatal substance abuse in order to ensure that I am doing my part to affect positive change in the lives of every single person I come in contact with, both as a nurse and as an individual. Thank you.